Hi, everyone. It's wonderful to join you today to announce our second cycle of the Evidence-Based Fellowship Training Program. Our 2024-2025 fellows are coming to the finish line. It's been a lot of fun. It's been a wonderful opportunity to immerse ourselves in hair loss with a depth that is found in so few places. And today I'd like to review with you our EBHF Fellowship Training Program and how the 2026-2027 program differs from the current program, and to welcome you to apply if you feel that this would be helpful for you. With no further ado, let me share my screen and we'll get going. So this is an international training program. We welcome fellows from all over the world. And in our current program, we have 120 participants from all over the world. From Australia, from various parts of Europe, from the US, from Mexico, from South America, from Canada, from parts of Africa, from parts of Asia. And so it's really a wonderful program that brings together people who are very interested in learning about hair loss at a deeper level. It brings together people that are currently immersed in helping people with hair loss, but realize there's more. That realize that with the acquisition of additional knowledge and skills, they can do more. They can do more to help their patient. And that's indeed what the Evidence-Based Fellowship Training Program does. Is it takes the participants on a journey of incredible learning about hair, but learning more than that, learning what it means to have hair loss, learning what it means to make decisions about treatment of hair loss, and learning about how we manage some of the world's most complex types of hair loss. How we manage hair loss in children, how we manage hair loss in adults, how we manage hair loss in someone 94, how we manage hair loss in someone 24, or 4 months, or 4 days. It's really a wonderful program, and it's a program that we've been thinking about so carefully since about 2016. And we were so proud to be able to launch it in 2024. And the program has really been a wonderful program, and our feedback, which I'll leave some comments at the end for you to see yourself, has been really positive. This is a program that I'm certainly very passionate about. This is a program where I'm really so honored to be the director of the program and share all of the principles of hair loss that I've learned, all the principles of hair loss that I've made mistakes about, and all the principles that are really needed to become an expert in this field. And with no further ado, let me review the basic outline of today. 2 things I want you to know before we start. We have program administrators who are wonderful, and they can answer your questions. I'll show the email a few times today, but it's info@donovanhairacademy.com. Reach out to them with any of your questions. This video, of course, is going to be posted online. And there's a course syllabus, which is very detailed. I don't know how many pages it has, but 50 or so, 60 pages. Please review it, because many of the answers are there. But we'll be having live webinars where you can ask questions, and those will be starting in the summer in the Northern Hemisphere in June or July, and there'll be webinars in August and September and October and November where we can answer your questions. and I'll be directing those webinars. The deadlines to apply is September the 1st for the early bird deadline, and you'll see why that's so important. And then the final deadline is December the 1st. And we may or may not accept late applicants. We did accept some late applicants for the 2024-2025 program. And I'm so glad that we did. But we eventually had a cutoff where it just wasn't possible anymore. This is an intense program. This is the most comprehensive program in hair loss. And we build upon prior knowledge. And it's absolutely impossible to get caught up after a few weeks. There's just no possibility. The intensity of this program and the depth that we dive and the knowledge that we gain and the skills that we gain is really what makes this so special. And we try to do it in an environment which is fun and enjoyable, with assignments and quizzes and lectures and opportunities for case discussion. But I think the really important thing today as you review this is to make no mistake that this is a very intense program. It's not a weekend program in how to manage hair loss. It's not a brief program in the basics of hair loss. This is an intense program. This is an intense program that combines the principles of dermatology of the scalp with internal medicine and rheumatology and allergy and immunology, obstetrics and gynecology, with psychiatry and psychology and pharmacology, and continues to integrate these principles throughout the 2 years of the program. It's an intense program. And if you commit the time each week, which is about 6 hours minimum, and you keep up with the assignments and the quizzes and the lectures, it's a really enjoyable program. It's a program where you will learn and acquire skills and knowledge and like no other. But if you fall behind, it's frustrating and it's difficult and it becomes impossible to catch up. So make sure you have the time. And if it's not the right time, you might consider joining us in 2028, 2029. So we're going to talk about why the course was created. What are the components? How do you apply? What are the deadlines? What are the fees? And how do you ask questions? So this is our program guide on the left, and you'll see this on the website at donovanhairacademy.com/EBHF. And if you don't know the Donovan Hair Academy website, do check it out. The email address for our program is info@donovanhairacademy.com. And you can reach out to our administrators and they'll help answer your questions. And they're wonderful and very knowledgeable and can answer the most challenging questions about pretty much anything. And I'm so honored to work with a team that knows so much about how to take care of our current fellows, but has so much knowledge about so many of the principles of hair loss through working with me over the last 2 years that it's really been a lot of fun. So I ask any of our team if you have any questions. But if you're interested in the 2026-2027 program, be sure to jump on the website, donovanhairacademy.com/EBHF, download the program guide, and review it. As you'll see in the application, it's a requirement to review the program guide. And so that's a necessity. And the reason it's a requirement is we really want you to understand what this program is about. This is a really incredible program, but you have to have the time for it. And it has to feel right to you. And we'll review some of those principles today and help you formulate a framework if you feel this is for me, or if you feel this isn't for me. 2 deadlines to be aware of, as I mentioned. September the 1st, this is the early bird deadline. This is the deadline that is really important because one can save on fees, and it really helps us get a sense of how we lay out the program and many aspects of the program. And then December 1st is the main application deadline. That is when not only do you have to have applied, but fees have to be paid, and you have to be ready to go for the January 7 first day. We'll talk about more in just 1 minute. Our YouTube channel where this is posted is Donovan Medical. This video will be on the Donovan Hair Academy website, but this will be on the Donovan Medical website as well. The Donovan Medical website is our website where we have wonderful videos pertaining to many aspects of hair loss. And we also host the evidence-based hair podcast videos on the Donovan Medical website. And do check it out if you haven't been there before. It's really a great resource for anyone interested in hair loss. So this is a program for someone who says, I want to expand my skills and I want to develop expertise so that I can help people with hair loss even better. I want to expand my skills so that I can improve how I diagnose hair loss in a 2-year-old or a 20-year-old or a 40-year-old. I want to improve the skills at which I approach the management of hair loss in someone with male balding who hasn't responded to minoxidil or finasteride, or a female who isn't getting better with minoxidil, spironolactone, laser, PRP, microneedling. What do I do? An 18-year-old male who's graduating high school and has alopecia areata, advanced stages, and has failed methotrexate, has failed diphencyprine, has failed tofacitinib, has failed baricitinib. What options are available? How do we approach this? How do we approach all these hair loss conditions in a logical, evidence-based manner, understanding first line, second line, and third line treatments, understanding side effects, understanding how we monitor these side effects? So for someone who says, I know there's more out there, I want to expand my skills to develop this expertise so that I can help more, then this program is for you. So this program was created really to nurture a group of individuals that say, I want to be an expert. And about 10 years ago, 11 years ago, we used to offer a 1-week program. And we did that for many years while I was working in Toronto, Canada. And it was a wonderful program. And practitioners came on the Monday, and we had Monday, Tuesday, Wednesday, Thursday, Friday together, seeing patients, having lectures, doing hair transplants. And it was great fun. We learned a lot. We made great friendships. And there's a lot of incredible things about that program. And there are many practitioners that have participated in that program who are wonderful practitioners in the area of hair loss. But the one thing I felt in that program is I would love to be able to take the basic essence of that program and expand it into a longer longitudinal program that allows us to dive even deeper, that allows us to reflect on a lot more, to make more mistakes, to clarify more myths and misconceptions, and to think more critically about a lot more problems. And that really led to the evolution of the evidence-based hair fellowship. Can we welcome a group of individuals that are currently working with people with hair loss problems, thinking about hair loss? Can we take them under our wing and help them? Help them to slowly acquire an incredible knowledge and skills that fills their toolbox, not only with what treatment should I use next, but problem-solving skills. Why isn't this dandruff? Why is this allergic contact dermatitis? And why do you think that's psoriasis when actually it's dermatomyositis? Or you have recognized that that's telogen effluvium, but where we failed to realize is this patient has Graves' disease, or this patient has inflammatory bowel disease, or this patient has an eating disorder. And this patient has an eating disorder that's so disguised to you, and it's so disguised to the family. How do we acquire that set of skills that really sets us up to take on any challenge? That's how the EBHF came about. So it's really to complement one's own activities. If you're a resident and you're immersed in dermatology training, we can build on that. If you're a fellow in a training program in hair transplant surgery, we can build on that. If you're a dermatologist seeing patients with skin problems, hair problems, you're doing surgeries and you feel, I'd like to be my local expert in hair loss, but I don't really know how to build that skill set right now, and I can't devote a year to visiting a location. That's what the EBHF can do. Or if you're an allied health professional, naturopathic physician, if you are an experienced trichologist, and your feeling is, I want the guidance to develop this skill set beyond what I can offer now, then that's what the EBHF does. And it's a very unique program in that way, and we have participants from all types of backgrounds. And the basic message is the same. If you have the time and the passion, this program will help you emerge at the end of the program with an incredible array of knowledge and skills to help people with hair loss. And that's one thing we're really proud of, is that, through consultation with educators and medical educators and adult educators, we've developed a program which really caters to the needs of many different backgrounds. And it's certainly not an easy task, but it's very clear. And it's something that I'm very interested in professionally as medical education, but, no matter your background, it's clear from all the fancy statistical analysis that's been done in the program by statistical consultants, is if you're willing to put in the time in this program will help you emerge very similarly with the same set of knowledge and skills. It's really incredible. It's going to be a lot more work for someone who doesn't have the same medical background to begin with, but if you're willing to devote the time, this program will guide you in that way. So a program created to help nurture and mentor individuals who want to become experts in hair loss. The opportunities for acquiring advanced training are quite limited. There are a limited number of fellowships. And in those fellowships, there are limited opportunities for hair loss training. And what I mean by that is, even some of the best fellowships in the world require the fellow to commit a certain amount of their time to research endeavors and a certain amount of their time to seeing patients with hair loss. And that's really important. acquiring those sets of skills is really important in a fellowship. I know, of course, having completed those types of training programs. But even within those fellowship programs, the opportunity to see and do and immerse and think is still limited. It's limited by the duration of the training program and limited by the number of days per week that you're seeing patients with hair loss. And so this program really serves to narrow some of those gaps and to complement what someone is currently doing, to complement the reading that a practitioner is doing right now, to complement the patients they're seeing, to complement the fellowship training that one might be in right now, to complement, past activities that someone has done. It's really to build on all of those learning opportunities that someone has had. And we have participants with all those backgrounds. We have current residents or registrars. We have fellows. We have early career dermatologists. We have dermatologists that have been practicing for 25 years. We have experienced trichologists. We have naturopathic physicians. We have nurse practitioners. And we have a number of practitioners who are extremely skilled and have been accepted into the program, who are specialists in research and pharmacology. And the basic principles are all the same, and that is that if you have the passion to learn, this program will get you there. So the main objectives are to help assist practitioners advance their skills in acquiring the necessary foundation for lifelong evidence-based learning. The world of hair loss is going to change. I can promise you that some of the aspects of what's a first-line, second-line treatment for lichen planopilaris or folliculitis decalvans or alopecia areata that we learn in the EBHF are going to be a bit different in 2029. Not too different, but a little. But they're going to be a lot different in 2049. But what won't be different is the problem-solving skills that are necessary for thinking about hair loss. How do we combine the elements of a history with the elements of the clinical exam and trichoscopic exam with any information that comes from blood tests and biopsies into thinking about a diagnosis? How do we recognize that something doesn't seem right here? That this patient with an itchy scalp and eyelid dermatitis that was thought to be a contact dermatitis to their shampoo actually is a patient with dermatomyositis. How do we build this instinctive type of thinking so that we can calmly approach any situation? Not that we approach a situation with, this could be what we call a zebra. This could be a really rare thing. Not that we have that mentality with every patient, but so that we have a balanced approach. So that when we take a history and examine a patient, we know the things that just make us pause, make us take a deep breath, and make us feel this isn't the typical situation. And those types of skills will provide us with the necessary skills for a lifelong of being a hair specialist. And the same is true with treatment. How do we approach new treatments? Well, if I hear about a new treatment that I just read about yesterday, do I use it tomorrow in my clinic? Not at all. Any new treatment has to earn the respect of a first-line treatment. And there are dozens and dozens of treatments that hover in the stratosphere of, you might be interesting someday, but you're not interesting today to me. The problem with this field is that too often it becomes, I'm interested in you today. And we neglect the principles of evidence-based medicine where we have first-line, second-line, and third-line treatments. And wow, is it ever a privilege to be a first-line treatment? You've proven yourself in either safety, affordability, feasibility, or effectiveness. You've proven yourself. Second-line treatment's pretty good as well. Third-line treatments could be helpful. Not something I would start with. But many treatments come on board as third-line treatments, move up to second-line treatments if they prove themselves, and move up to first-line treatments if they prove themselves yet. How do we acquire this type of thinking for a lifelong practice of evidence-based hair loss? So who's a good candidate? A candidate is someone who sees patients with hair loss. And as someone very wise once said to me, if you have the fire in your belly, where you want to be an expert, you have the passion that you know what is possible, but you know it's not here today. If you have that passion, this program's for you. And that's really important because it's an intense program. But if you have that 6 hours a week to commit to this program, it's an incredible program. And I'll leave some comments at the end, and I hope as you review this presentation today, you'll come to understand the unique aspects of this program. But it's not designed for those brand new to the field. It's not designed for someone who has never seen a patient with hair loss. It's a little bit too challenging for that, but you don't have to have a lot of knowledge and skills. We will build on that. But you have to come to the program with a basic set of knowledge and skills. That's male balding. You can use minoxidil. That's alopecia. Some people use steroids. Some people use other things. That is telogen effluvium. You should check the iron and thyroid. That is probably a scarring alopecia. I don't really treat those because I'm not really comfortable. Great. We need to have some basic knowledge to work with. That's so important in this program. So it's not a program for someone brand new. It's not a program for someone who doesn't have the time to commit to the program. And it's not a program for someone that says, you know, I'm really good with where I'm at now in my practice. I'm happy with everything, and I feel like I can offer my patients everything they need, and I feel like, you know, there's no really room for improvement. That's not a program for you. The program is for people that really feel that I want to commit to a program where I can acquire a whole new set of knowledge and skills and a whole new approach to diagnosing and treat hair loss. And a whole new set of problem-solving skills that's going to set me up for 2035 and 2055. The objectives of the EBHF are in our program guide on page 7, so do check it out. Be sure to download the program guide, save it, read it. A lot of really important objectives will be covered in our 2 years together. And we think very carefully about these objectives. They are addressed through lectures, assignments, multiple choice questions, quizzes. So we're going to understand the aspects of a patient history. What do we need to know about patient symptoms, the speed of hair loss, their past medical history? What are some aspects of the history that we really need to know? And what are some of the aspects of the history that aren't important? How do we do a scalp exam? What's important? What's not important? I'm going to spend a whole lot of time talking about trichoscopy of all the hair disorders, trichoscopy of androgenetic alopecia, trichotillomania, alopecia areata, scarring alopecias. I'm going to spend a lot of time talking about blood tests. Which ones are useful? Which ones are not useful? How do we use blood tests to really help understand the comorbidities that exist with a patient? Most patients with hair loss need CBC, TSH, ferritin, vitamin D. But don't you think a patient with androgenetic alopecia who is obese needs cholesterol and a basic metabolic profile, glucose, hemoglobin A1C, their blood pressure checked? They sure do. Because patients with androgenetic alopecia seem to be at increased risk for metabolic dysfunction and metabolic syndrome. And many studies support the notion they're at increased risk for heart attacks and strokes. Don't you think that a patient with androgenetic alopecia fitting that profile should have a baseline cholesterol, triglycerides, blood sugar? Yeah, they should. And so how do we think about these aspects of the blood test, not only for what could be relevant to hair loss, but thinking about what could be relevant to a human being with hair loss and all the comorbidities that exist? What are the blood tests that we might need to think about in someone with alcohol use disorder? What are the blood tests we might need to think about in someone who has an eating disorder? What are the blood tests we might want to think about in someone with without a fixed address or is homeless? All these things are really important to think about. And a key part of the evidence-based fellowship training program is to think beyond the hair, to not be so fixed that we are just specialists in these dead keratin fibers on the scalp, but we are practitioners who care about human beings, and we're practitioners that care about the big picture. Because I promise you that by caring about the big picture, you will help patients with hair loss far better than if you're focused on being a specialist of these fibers. That's for sure. And you'll come to see that in our 2 years together. And what we really hope to do is to develop those skills slowly and to develop those skills and integrate those skills continuously so they become second nature. And so we're going to talk about hair disorders in children and adults. We're going to really develop broad differentials and think about these types of conditions. We're going to talk about hair transplant surgery. A great portion of this hair fellowship is addressing some of the non-medical, non-surgical aspects of hair loss, but principles of surgery are integrated throughout, and we have dedicated weeks, of course, to hair transplant surgery. But what are some of the reasons that hair transplant surgery can be a challenge? What are some of the reasons that some hair transplant surgeries are not successful? Of course, many hair transplant surgeries are successful, the vast majority of them. Well, one of the reasons is a failure to recognize some of these broad principles related to the diagnosis of hair loss. And so for each block that we speak about, androgenetic alopecia, telogen effluvium, alopecia areata, scarring alopecia, we'll be integrating some of these concepts into understanding the candidate for hair transplant. Do you recognize that this patient actually has diffuse unpatterned alopecia, DUPA? Do you recognize that this patient actually has lichen planopilaris? Do you recognize that this patient isn't a candidate for surgery? And so those principles are very important. And, one individual shared with us in this fellowship program that, this is one of the best hair transplant courses, which is really an honor to have that comment given, but it's so interesting because in so many ways, this is a program that can set a hair transplant surgeon up to have fewer failed transplants, to recognize the candidates that are good and to recognize the candidates that are not. And so we integrate those principles throughout. talking about a lot of therapies here. And what's important as you reflect on this program is to reflect whether these therapies are therapies that you would like to know about. We'll be talking about minoxidil and finasteride. But so much of the hair world is minoxidil and finasteride and minoxidil and finasteride and microneedling and minoxidil and oral minoxidil and finasteride and minoxidil and finasteride and dutasteride and finasteride and minoxidil. But what about dutasteride and spironolactone and bicalutamide and hydroxychloroquine and cyclosporin and methotrexate and sulfasalazine and tofacitinib and ritlecitinib and baricitinib and prednisone? What about all of these therapies that help both scarring and non-scarring alopecia? How do we think about those, and how do we acquire the skills? And the EBHF really seeks to develop that type of thinking in a toolbox for therapies that is quite broad, and to understand these therapies with greater depth. And as mentioned, we're going to talk a lot about these comorbidities. We're going to be thinking a lot about problems of the gastrointestinal system, nervous system, reproductive system. Why? Because it's extremely important. And no single aspect has really allowed me to open the door to an entirely new thinking about my patients than this realization that it doesn't stop here and up. It actually goes down to the rest of the body. And so knowledge about the gut and the heart and the brain and the eye and the toes and the bones really do matter. And so this is a program for those that want to dive deep. And the fellowship combines the principles of dermatology and rheumatology and pediatrics and genetics and all the disciplines you see here, and acquires this type of thinking in a way that is enjoyable and fun and pleasant to think about. And we do that through assignments and multiple choice questions, as well as through lectures. Does the hair specialist need to know something about the eyeball? Absolutely. If we're going to prescribe hydroxychloroquine, we need to understand some aspects of retinopathy. If we're going to prescribe minoxidil, we need to understand blurry vision. It's rare. But if you don't understand what central serous chorioretinopathy is, then you're closing yourself off to understand something about the therapies you prescribe and how to care for your patients. Fatigue. What do we as hair specialists need to think about somebody with fatigue? We can either say, I help hair patients. I don't do fatigue. Go see your family doctor. And going to see the family doctor is the right answer. But what's important for us as hair specialists is to think about, does that fatigue have anything to do with what we're thinking about with the hair? Is the fatigue a malignancy? Is the fatigue low iron? Is it a thyroid disorder? Is the fatigue a side effect of your therapy? The patient's fatigued because your prescribed treatment has caused them fatigue. And so, yes, you can go see the family doctor, but you're telling the patient to go see the family doctor because the treatment you've prescribed has caused them fatigue. So we really need to understand a broad approach to thinking about all of these disciplines. And some of this is changing. And what we're trying to do in the EBHF is set the fellow up for a career of lifelong learning, to really feel that there is so much more to helping people with hair loss than helping their hair loss. And it might not be that you help other aspects directly, but you help with the thinking process that goes into helping people. If we're going to talk about the gut microbiota and how important the gut microbiota is, and the microbiome and the microbiome and the microbiome, it's important we understand the microbiome. If we're going to talk about metabolic dysfunction, then we need to understand metabolic dysfunction. If we're going to talk about the menstrual cycle and how this caused irregular periods and this caused irregular periods, then what is the menstrual cycle? How is it regulated? What are the hormones that regulate it? What does it mean when a 32-year-old has an FSH of 17? And why do I feel worried? What is the follicular phase? What is the luteal phase? Why do we have to order these blood tests on day 3 sometimes? Why is it that whenever I hear irregular periods, I'm ordering LH, FSH, estradiol, prolactin, DHEAS, testosterone, LH, FSH, 17-hydroxyprogesterone? Why am I reflexively ordering these tests? Because there's a broad differential for what causes irregular periods, and they can be very relevant to the patient with hair loss. As we think about polycystic ovarian syndrome, as we think about primary ovarian dysfunction, as we think about the athlete's triad, as we think about eating disorders, as we think about disorders of prolactin, as we think about all of these entities, these absolutely can impact the hair. And so really understanding the menstrual cycle is very important for every hair specialist. Polycystic ovarian syndrome is dramatically underdiagnosed. And one of the ways to quickly change that statistic is to understand that it's dramatically underdiagnosed. So when you're seeing a 29-year-old female with androgenetic alopecia and acne, your feeling is, I wonder if it could be polycystic ovarian syndrome. What questions do I ask? What tests do I think about? And if you think that it's not important for a hair specialist to say to that patient, do you have irregular periods? Did you have irregular periods? Have you ever had irregular periods? Do you have hair growth on the face? How has your weight changed in the last 4, 5, 10 years? Have you been pregnant before? What oral contraceptives have you been on, if any? What contraceptives have you been on, if any? Have you had any issues related to blood sugar or diabetes? It's this type of thinking in a very calm and systematic way which allows us to think about these entities. And why do we need to think about them? Because by addressing these issues, we improve the life of the patient, and by addressing these entities, we often improve the hair. And so when you're thinking about how to take that patient with hair loss who's been to this specialist and that specialist, and they're getting better, but they're not getting as good as we want, guess what that next step is? That next step is approaching this situation with a calm and methodical manner, understanding these comorbidities, optimizing these comorbidities, and applying the principles of evidence-based medicine to connect them with treatments that are next. And I wouldn't offer this course if I didn't believe that that type of thinking leads to significant improvements in outcomes. If this was all theoretical, that, yeah, human beings get this and that, and you could do this and that, it doesn't really do much, there really wouldn't be a point. And I wouldn't feel right and good about getting up each day and applying these principles and sharing these principles as we do. But it does make a difference. If we're going to talk about iron, we need to understand iron. If you're going to talk about iron, you need to understand this wonderful molecule ferritin and the fact that someone with low iron and iron deficiency can have a high ferritin. How does that make sense? So we need to understand all these principles of iron. We need to understand how we administer iron, how we give iron. We need to understand about menstrual disorders that give iron deficiency, ranging from uterine fibroids to gastrointestinal disorders that give iron deficiency, ranging from celiac disease to cancer. How do we think about iron deficiency in a calm yet methodical manner that helps the patient? If we're going to talk about depression, we got to understand depression. How do you define depression? What is depression? How do you treat depression? If we're going to understand eating disorders, we need to understand the principles of anorexia and bulimia and other eating disorders as well. And if you're going to understand how drugs might affect heart rhythms, well, we have to speak about them. We don't have to dive into the reading of EKGs. That's not something that a hair specialist needs to know. But what we do need to know is that a drug like hydroxychloroquine or Plaquenil rarely can affect heart rhythms. And when you combine that with a patient who's slightly older, who's female, who has kidney problems and is on another medication that can prolong the QT interval, you're setting yourself up for problems. And really a large part of the EBHF is how can we practice in an evidence-based manner? After all, this is the evidence-based hair fellowship. But how can we practice in a safe manner, safe for the patient? And these are really important parts of this program. And we reflect on this through assignments and quizzes and lectures. And this takes time. It takes time to develop a solid set of skills. You know, as I've often said before, it takes time to be a great tennis player. It takes time to be a great musician. It takes time to be great at whatever it is your endeavors are. But one thing I strongly believe in is that certainly some people have natural talents. There's no arguing that. But with enough application of time to an endeavor, the vast majority of people can acquire the skills to shine and perform and develop that expertise. If you want to be, you know, a world-class tennis player and you're willing to devote the time, and it could be a lot of time, you can rise up to a very good player. If you want to be an expert painter and you work with the right people that can teach you and you can practice and make the mistakes, and your first, 25 years, your canvases look not really so great, but you continue to work and devote the time and effort and skills, you will be great. And I really believe in that, if you're willing to devote the time and you have the passion and you have the right teaching, time, passion, teaching, the world is yours. And so we really need that time in this program. We really need that time to immerse yourselves in everything this program has to offer. Where this program becomes, this is really a wonderful program, is if you have the time. Where this program becomes, is if you don't have the time. So if you apply, make sure you have the time. We want at least 6 hours a week. And some of our fellows will say, I spend more than that. Jeff, I spend up to 10 hours a week. Great. And certainly those fellows that spend more time and devote more time really get much more out of this program. But of course, what you have to decide is what's right for you. If you are able to devote 6 hours, 5 hours, that's wonderful. You're going to get a lot out of this program. If you're able to devote more, I can't tell you what this program can offer you. The world is your limit. And this program is a comprehensive program where the principles are really, all the principles of hair loss are shared. All the things that we need to think about are part of this program. All the limitations we have in the current time are part of this program as well. So it's designed for dermatologists and hair transplant surgeons and trainees and dermatology trainees and plastic surgery trainees and cosmetic surgery trainees. It's for family physicians who are wanting to see more patients with hair loss or who are thinking about reclassifying in the area of hair loss. It's for dermatology residents that say, you know what, I'm in year 3, 4, 5, and I'm heading in this direction to be a hair specialist, and I want to incorporate this now. I have permission from my program to devote this 5, 6 hours a week. But it's also for our allied health professionals. And in our first iteration of the program, I decided that this is what I want to do, is to offer this to our trichology colleagues, our nurse practitioner colleagues, our naturopathic physician colleagues, our nurse practitioners. And what a great decision that was. First, these individuals have really shown that, you know, this program can be used as a springboard to flourish more. And that's been great because that's the purpose. But really, with enough time and effort, the outcomes in thinking and problem solving are equivalent to anybody else in the program. But I won't kid you that some individuals that come in with a lot less knowledge have worked extremely hard to acquire that level of skill. And some of our participants, certainly work incredibly hard in this program with their reading and reflecting. If you want, you can do a multiple choice quiz that we have each week in 10 minutes. No problem. But some of our fellows take 3 hours, 4 hours, because they think and reflect on each question. Because each question is given to you for that purpose, to help you refine your problem-solving skills, to help you think critically. And so if you recognize each of these things that you're given as a wonderful opportunity, the program is incredible. But it's not appropriate for everyone. Please do keep that in mind. And I'll go through all the applications. And, if I feel that the program's great for you and I think you'll be successful, then we'll accept you. If I feel not quite yet, then, it's just a reflection that perhaps you need more time, perhaps you need to do some other courses in basic hair loss or, basic other certification programs, then come back and see us again. You'll get so much more out of the program and you'll be so much happier in the program, and the program will just be a real joy. And so if we don't accept you in the program, it's simply because we know that at the right time, this will be incredible for you. And we want you to have that feeling. We want you to feel like so many of our fellows do here at the home stretch. We just have a few more months to go. We really want you to have the feeling that this is great. I love this program, and don't stop, don't end. We want you to have that real joy. And if I feel that won't happen, then we'll ask you to come back and see us again. So when you think about a situation like these on the screen, are you wondering how to treat a 3-year-old with alopecia totalis? Are you wondering what to think about with someone on a JAK inhibitor who has rising liver enzymes and a CK of 523, or a 22-year-old male who has breast enlargement on finasteride? If you're wondering, well, that's interesting, what do we do with those situations? Then this is a program for you. If your feeling is, I don't want to know that, then it's not a program for you, maybe. Maybe there's other aspects that are important. 51-year-old female with a rising creatinine or kidney, decreasing kidney function. If you're wondering, that sounds interesting, what do you do there? Great, that program is for you. If you're wondering what to do with a 91-year-old with new onset hair loss, program's for you. And as you'll hear me say in the program probably 15 times, a 91-year-old female with hair loss, new onset, is going to be an interesting consult. I promise you. And you'll come to see why that is. You'll come to see why a 91-year-old with new onset hair loss this is going to be good. This is going to be interesting. This is going to be something at the end of the day, you put your feet up and you think, wow, what an amazing honor that I'm participating in this field of helping human beings with hair loss, because it's so much more than just hair loss. A 33-year-old female who's gone from shoe size 6 to 7 because she's on oral minoxidil. What do? A 67-year-old female with androgenetic alopecia with new onset hair growth on the face and acne. What you'll come to see is that this situation creates a pit in your stomach, because you're thinking this woman has hyperandrogenism. And I have to figure out why she has hirsutism and acne. Does she have exogenous testosterone that's helping contribute to this? Does she have a tumor? Does she have a malignancy, an ovarian cancer that's driving this? How do we develop this type of thinking so that we reflexively think about these situations? And a 66-year-old male with an itchy scalp and rashes on the neck and eyelids. Do we even give dermatomyositis a consideration? And do we realize that this man has lung cancer? Or do we continue to tell him to change his shampoos because he has shampoo allergy? Or do we realize that this man has features of dermatomyositis? And so we have a number of special groups, and we'll continue them in this next iteration of the program. That includes not only our physician colleagues, but our naturopathic physicians, our nurse practitioners, our trichology colleagues, our medical researchers also. So my job as the program director is to really guide you and help you. And we have 2 years to do this together. And following completion, you'll have a certificate that shows your completion, and certainly gives you the opportunity to share with others that you have completed the evidence-based hair fellowship. So we've made a few changes to the program. And we've made these changes based on reviewing how people do in the program. We have 3 streams in the 2024-2025 program. One is a group that comes on Wednesdays, one is a group that comes on Thursdays, and one is a parallel group where they watch the videos, do the assignments, do the quizzes, take the examinations. And what's been so clear with this, as we get all of our statisticians to review our data, is all 3 groups perform similarly based on their prior and past knowledge and skills. And so there's no particular advantage for any one of these groups. And what was really important for me to understand is, do the individuals in the parallel group who don't come to the live sessions, are they performing at a rate that is similar to all of the others based on their past knowledge and their past experience? The answer is yes. And how do we take into account all the different time zones across the world? In our Wednesday and Thursday programs, we have people that attend from all over the world. Some are showing up at 1 a.m. in the morning in their country, 2 a.m. And they've decided that that is something they'd like to do rather than the parallel program. How do we work with all the different time zones into a strategy that works? And so in the 2026 program, we will have each week a video released on the Monday. And this will be the lecture material for the week, which participants can watch at their own time during that week. Participants will complete the assignments and the quizzes like before. And every 2 weeks, we will meet for either one of two sessions on a Wednesday morning or a Wednesday afternoon. And the participant can choose which they want. Now, those are optional, but we highly encourage those attendances. This has given us an expanded opportunity for more question and answers and more cases and more direct interaction. We certainly have a lot of material to work through in our time together. And 2 years may sound like a long time, but I wish I had 4. And so 2 years is as we plan out the weeks of the EBHF, we're thinking, where do we put this material, this, do we put this, we're going to teach this concept in a quiz question, we're going to teach this concept in the lecture. 2 years is, may sound like a long time, but for the breadth of information and the knowledge and the types of problem-solving skills we hope to develop, it is just meets our requirements. And so this new program way of doing things opens up a little more time when we meet every second week for questions, question and answer. And so each week you'll have a video that's sent to you, you'll have the quiz sent to you and the MCQs. And every second week we'll meet to review some of the aspects of what you're reviewing, to go over your questions, and to review some of your cases as well, some interesting cases that you're participating in, and to review some challenging things that I'd like you to think about. We've also built more breaks and holidays into the program. That was really important. The current group has really gone through an incredibly heroic efforts in their current program. One thing we wanted to do in the first program is to provide a program which was minimal time duration. And that was 87 weeks. And in our first iteration of the program, I was concerned that if we had a longer program, then that would, by extending the program, that would be a negative thing. And so we've had almost consecutive weeks with a few weeks off only, which means some pretty intense 87 weeks for our participants. And what we're doing in the 2026-2027 program is introducing more breaks, more holidays. And that will be a wonderful thing. And when you download the program guide, you'll see where those breaks are integrated. But there's 4 training blocks. Block 1 is an introductory block, a really important block of around 20 weeks, which is providing you with a fundamental set of skills in everything hair. It's a wonderful block. Many people after that block feel like, could there be anything more we need to learn? And then we go on to block 2, 3, 4. And then you realize, oh, there is more we have to learn. But block 1 is really great. Block 2 focuses on androgenetic alopecia, telogen effluvium, alopecia areata. Block 3 focuses on scarring alopecia, contact dermatitis, hair shaft disorders. And a very intense block of lichen planopilaris, frontal fibrosing alopecia, CCCA, dissecting cellulitis, folliculitis decalvans, erosive pustular dermatosis, discoid lupus, acne keloidalis. And then block 4 focuses on psychodermatology, hair restoration, surgery, cancer, infections. And so the blocks are of different lengths, but essentially after each block, we do an exam. After another block, we do an exam. And after the third block, we do an exam. And after the fourth block, we don't do an exam because we're getting ready for the final exam. And we have examinations in the program not as a means of increasing stress and anxiety. That's not really the purpose. The purpose is just for self-reflection. And it's one thing which is really clear is if you participate in the program, you do the assignments, you watch the videos, you do the quizzes, it's a guarantee to pass the exams. Why? Because we have thought so carefully about the methods of adult learning over the last 8 years that it's a guarantee that you'll have the principles reiterated so many times. You'll have the opportunity to think about these principles so many times. And with the multiple choice questions and the assignments and the lectures, it's a guarantee. Where the problem comes is if you're not able to participate in the program, that's where it becomes a problem. And so we put in these block exams as a way of self-assessing and a way for us to help identify people that needed more help and help identify situations where maybe the person should withdraw from the program now. It's not the right time. And life happens. There's a lot of things that happen in a 2-year period that make one realize that, listen, I can't do this. And that's okay. There's things that happen to you. There's things that happen to your family. There's things that happen professionally. There's good things that happen and there's bad things that happen. But those things happen. And we really want to be able to step in at the right time to identify those and be able to say to you, what can we do to help? So we have these block exams and you have to pass each exam to go on. You have to get a score of 70% to go on. You have to get a score of 70% on block 2 to go on to block 3. And you have to get a score of 70% on block 3. Now, if you don't get a score of 70%, you can take the exam again within the first month or two. On one reason, you can take the exam again if you've attended half of the Wednesday sessions. So every second Wednesday, there's a live session, 2 hours, either in the morning or the afternoon in Pacific Standard Time. It'll be different in your country, and you can choose either one. If you attend 50% of those sessions, which we feel are really, really important, then if you fail the exam, you can take it again. If you don't attend 50% of the sessions, you can't take it again. Why? Because it's so clear to us that participation in this program is a guarantee for success. It's something we pour our heart into. That we want you to understand that we are trying to nurture a very special individual, and that is a world expert in hair loss who is going to help others. And we're so confident in that if you participate in the program, that'll be you at the end of the 2 years, that we give that added bonus that if for some reason you don't pass the exam, you can take it again. There's almost zero chance you won't pass the exam if you participate in the program fully. It's as simple as that. And for the final exam at the end of the program on December the 8th, December the 1st, before we say goodbye, you have to get 50%. Why 50%, not 70%? Well, the final exam encompasses an entire breadth of the 2 years of material. And we also want the final exam to be an opportunity for you to reflect on a lot of material and challenging material. And we want to challenge you. And we want to set the exam in a way so that we know that, your scores are going to be somewhere between 70 and 100. Most of you, 70 and 100. But we want that pressure relieved so that you don't have to worry about this, but that you can take on some fun and challenging situations in your exam. So the one thing that's different about our exams and our quizzes is that our quizzes aren't out here to help you get perfect scores. And some of our brilliant participants in our program, when they do their weekly multiple choice questions, they get 75, 80, 80%, and these are crackerjack practitioners. Why? Because we want these questions to benefit you. We don't want you to take a multiple choice exam if we feel it's just about you going through the motion of pressing buttons to get 100% each time. That is a model for some programs. Where some programs want their participants to feel good. We want you to learn. We want you to learn, and we want you to make mistakes. And there's nothing better for the brain than to make a mistake and realize, I made a mistake. That's a wonderful way to learn. When you say, I made a mistake. I can't believe I got that question wrong. That's how you learn. And so there's many opportunities in this program to make mistakes. That's really important. So when are the lectures? We have the lectures that are sent to you via video every Monday morning, and you'll have these mailed to you with links so that you can watch them. And the lectures are generally 3 hours in length. Some are 2, some are 3, but they're generally about 3 hours in length, and you can watch them at any time during the week. And then we'll meet live every second week, and you can choose whichever window you'd like. It's generally the first and the third Wednesday of each month. One of the groups is a meeting Wednesday mornings, and you can check where your part of the world is and how this corresponds. And one is Wednesday afternoon in Canada. And so there's one time which starts at 5 a.m., one starts at 4 p.m. And so this corresponds to 8 a.m. in New York, 1 p.m. in the UK, 2 p.m. in much of Europe, 4 p.m. in Saudi Arabia. And that would be probably a preferred time versus the latter time, which would be 1 a.m. in Central Europe and 2 a.m. in Saudi Arabia. But we certainly have some individuals in our program that really enjoy these later times. They tend to be night people, and so it's really whatever suits you. Remember, these are optional attendance. We really think that this is important and valuable, and so we do hope that you'll attend. It's an opportunity to come together as colleagues, to reflect on cases, to share ideas, to reflect on issues in the last 2 weeks and challenges. And it also gives you an opportunity to retake an exam, and if you didn't do well. So if you attend 50% of the exams, if you attend 50% of the sessions, you're able to retake an exam if you were to fail it. And again, I say that in the sense that it is almost an impossibility to fail an exam if you participate in the program. So let's take a look at what a January would look like, our first 4 weeks together. On January 7th, you'll have a lecture, an assignment, and a quiz sent to you. There will be a meeting where we say hello and review some important things together. The topic will be non-scarring and scarring hair loss and an introduction. January 14th, there will be no meeting, but there'll be a lecture, an assignment, and a quiz sent to you. It'll be about taking a history. January 21, we'll be back together, but there will be a lecture sent to you and an assignment and a quiz. We'll be talking about the scalp exam. And then January 28th, the topic is trichoscopy. There'll be no meeting, and you'll have a lecture, an assignment, and a quiz sent to you. And in some weeks, there'll be no quizzes, no lecture, no anything. It's a break. And those are really important in our 2026-2027 program. Some weeks will be dedicated to your cases. So we'll ask you to send in challenging cases you'd like to discuss. And these have been really popular in the 2024-2025 program. And we've had just incredible cases sent in each time. We usually do between 7 and 10 cases. And, the most challenging cases you can imagine. And we review, aspects of diagnosis that are challenging, aspects of treatment that are challenging. And these are cases from around the world. And it's been wonderful. It's been wonderful to reflect on these challenging cases. And it's been a real wonderful asset to the learning of everybody, including myself. So what's a typical week like? Well, Monday morning, Canada time. In your email, you'll have a welcome to week 52, and you'll have a link to a lecture, and you'll have a link to this is your quiz and this is your assignment. And you'll work on the quiz and assignment during the week, and that'll be due by the next Monday. Generally 1 or 2 short assignments, and these assignments are very carefully constructed to help your learning and development in your problem solving. And the assignments can be submitted in a language other than English or Jewish. And then the answer to the assignment will be provided to you the following Monday via video. And you can review your answer. We require you to complete 70% of the assignments. We'd like you to do 100% for your own learning, but we understand some weeks are busy. Some weeks you can't get to it, and that's fine. You'll also be given a multiple choice quiz each week. We'd like you to do all the multiple choice quizzes because over the course of the EBHF, you'll have probably close to 2,000 MCQs to help stimulate the neural networks in your brain to think about hair loss in ways that are so valuable. And we'd like you to do all the quizzes. They're for you. They're designed for you. And if there's a quiz question which is not helpful, redundant, we take it out. So every single quiz question that's been designed has been designed to help you think and develop as a hair specialist. But we'd like you to do 90% of them. Again, a reflection that some weeks you just can't do this. Some weeks you have to take some things out of your schedule, and that's fine. Here's a quiz question this week in our week 62 MCQ for EBHF participants. This is what they look like. Some of them are long question stems. Some of them are short. This is what it looks like. Which of the following oral antibiotics is safest in pregnancy? Doxycycline, ciprofloxacin, cephalexin, or rifampin? So you'd click whatever one you think. The answer is cephalexin is the safest. And then you'd click next. And you do the MCQ, which ranges from 25 questions to 40 questions, sometimes a little more, and then at the end, you'll be provided with your score and you'll be provided with the answers to all the questions. You'll be emailed them. And for the weekly quizzes, you don't have to get any particular score. We would like you to consider taking it again if you get less than 70%, but that's up to you. That's up to how you feel about your learning and how much you would like to improve. But on the weekly quizzes, all that matters to us is that you've gone through this, you've taken the quiz, you've seen the answer, you've reflected on it. That's what's important. For the end of the block quizzes, exams, and there's one at the end of block 1, end of block 2, end of block 3, we do require you to get a score of 70%. But these weekly quizzes are great because they really help you refine your skills. And the feedback on the quizzes has been great in the sense that we know that the quizzes are valuable. The quizzes are really helping you solidify your information and your knowledge, and they're really helping you develop your skills in problem solving. And we want you to make mistakes on the quizzes. We purposely create the quizzes in a way so that some questions we hope that you get wrong because it allows you an opportunity to reflect on an error in your thinking. But quizzes have to be completed by the next Monday. Assignments have to be completed by the next Monday. And if you complete them, you get credited for them. And if you don't complete them, then you don't get credited for them. And in the EBHF, we require you to do 70% of the assignments and 90% of the MCQs. So your time commitment is at least 6 hours a week. So do keep that in mind. And do keep in mind that there are some fellows that spend even more than that. And, you know, there are absolutely some fellows that are spending 10 hours a week in the program. And I want everyone to be aware of that. And we're very upfront about that this is an intense program. This is an extremely comprehensive program in hair loss. And it's, you know, the most comprehensive program in hair loss that exists. Because we truly believe that all these aspects of understanding hair loss in this manner is really relevant to the development of an expert. So again, we want you to do 70% of assignments, 90% of quizzes, complete all your block examinations, and then complete the final examination and get a score of 50%. If you don't pass a weekly quiz, no problem. You don't have to take it again if you don't want to. We'd like you to take it again if you get under 70%. That's for your own learning. If you don't pass a block exam and you've attended 70%, 50% of the sessions, the live sessions, you can take it again within a month. If you don't pass a block exam and you haven't been to any live sessions, then unfortunately we would ask you to withdraw from the program. And we'd invite you to apply again. It just may be a reflection that now is not the right time. And if you don't pass the final examination, if you've attended 50% of the live sessions, you can take it again within the first 2 months. But if you have not attended any live sessions and you don't pass the exam, then you would not be awarded the EBHF certificate. Again, we're so confident that if you participate in the program, watch the lectures, do the quizzes, do the assignments, that you'll be successful, that we want you to know that we feel that this is not something that that you should have any worry about. These are simply achievement milestones that we have put in place in the program to really award that people that are participating in the program and doing the work, you know, can be successful in achieving a certificate, but people that are not able to, for whatever reason, are not able to achieve the same certificate. And so you do have to put in the work. But we're here to help you. And as the program director, I'm here to help you be successful. There's nothing I want more from the day that you apply than to see you 2 years later be successful, and to see you 10 years later and 20 years later help people with hair loss in a whole new way. That's why we have set up this program. We've set up this program because I know that if we can help you acquire a whole new set of knowledge and skills in hair loss, that you can then help so many more people with hair loss, and perhaps inspire other practitioners as well. So we encourage applicants to apply with backgrounds in dermatology, plastic surgery, trainees, hair transplant surgery trainees, hair transplant surgeons that are taking various examinations as well, trichologists, allied health professionals, nurse practitioners. And so we have 5 groups of applicants. Group 1 applicants are our dermatologists and our physicians and our hair transplant surgeons. Group 2 applicants are the same, but from countries that are listed here. And in the EBHF, we feel it is very important to acknowledge the participation of these countries with a different fee. And it is really important that we train physicians with advanced knowledge in hair loss around the world. And we would really like to continue to see practitioners from diverse countries around the world train with us. And it's been really an honor to have many Group 2 participants in our program. Group 3 applicants are our trainees. And those are our residents and fellows and plastic surgery trainees. These are Group 3 applicants are generally individuals that are in a formal training program. And there's a daily supervision of that trainee, i.e. a resident. Again, generally the knowledge and skills that is required is a little bit higher than a medical trainee being a medical student. This program would be a little bit too challenging for a medical student who hasn't had an opportunity to immerse themselves in seeing hair loss patients. But a dermatology trainee or a plastic surgery trainee or a hair transplant fellow is seeing hair loss all the time and can jump aboard in this program in a way that really allows them to excel. And we have residents, trainees in our program, and they excel in the program. Group 4 applicants is a group of individuals that are not physicians. They include our trichologists. And unfortunately, we're not able to take all trichologists, but if you're a trichologist with advanced skills and experience in the field, please consider applying. The program is wonderful. And we have many trichologists in our program. If your skills and experience in trichology are new, consider applying and we'll review your applications. The issue is that it can be a little bit challenging if your experience isn't quite the same as someone else. And again, we want you to enjoy and have fun and find this program, wonderful. And based on your application, I'll be able to help guide whether I think you'd flourish in the program or not, and that's important. There's also nurse practitioners in our program, naturopathic physicians, physician assistants, and please consider applying if you'd like to immerse yourself in this field. Again, it's important that you have some prior experience. So if you're a nurse practitioner working in an office, you're seeing patients with hair loss, this is a great program. And we have nurse practitioners in our EBHF that are extremely successful in the program. Same with naturopathic physicians. We have naturopathic physicians in our program as well, which are excelling. And so we really put a lot of thought into our first year of the program, the 2024-2025 program, whether or not to extend this. And I'm so glad that we did, because these individuals are not only enjoying the program, but are really doing extremely well in the program and using all the resources in the program to develop their knowledge and skills to levels that can be challenging to achieve otherwise. And Group 5 applicants are researchers, non-medical practitioners who are doing research in this field that would like to walk through the elements of developing expertise, clinical expertise in hair loss. And there'll be a limited number of spots, but this is a wonderful opportunity to immerse yourselves in all the things that we think about as hair loss specialists. You can imagine if you're doing research in metabolic dysfunction in central centrifugal cicatricial alopecia or metabolic dysfunction in androgenetic alopecia, that opportunity to think about how we as clinicians diagnose and treat hair loss and the medications and all of these aspects of problem solving can be really wonderful to develop your research career and the questions that are needed. Each and every week in the EBHF, we reflect on important research questions and gaps. And an important part of the program is really being comfortable with our current medical literature, both the knowledge that has been presented to us by various research papers, but also the gaps in the research world, the controversies in the research world, and the incorrect conclusions that have been offered to us in the research world. And so it's really a great opportunity to think about those things. The course is in English. We have participants from around the world, and some of the feedback in the program has been that the clarity of the program is good, and provided one has some basic skills in English, that they have found the program to be great. And that was really important to us, and obviously something that we think very carefully about. Can we offer an international program that helps participants with all backgrounds where their original language is not English? And the answer is yes. And that feedback has really been important to me. The one thing we offer is that when you complete your assignments each week, you can submit it in any language, and we will use all the software we have to translate it. But, if you speak another language and you'd like to submit those assignments, please do. The MCQs are in English. Someday with artificial intelligence and someday with other methods, we'll probably be able to have those in other languages. But for now, it's in English, and it has worked out quite well. The fees depend on a couple of things. The fees depend on whether one is in group 1, 2, 3, 4, 5. And the fees depend on when you're able to get your application to us. And if you're able to get your application to us by September the 1st with your payments, then the fees are similar to our 2024-2025 program. Our fees for the group 1, 4, and 5 applicants is 7,700 Canadian. The early registration, if you register by September the 1st, is 6,800, and late registration is 8,100. Now, these are divided into 3 payments. The first payment is due by those due dates, and then the second payment and third payment are due by July 21st and March 21st. These payment deadlines are provided you have been successful in your Block 1, Block 2, and Block 3 exams. And so if you're not successful in your Block 1 exam, then you would not continue in the program and you would not pay the second fee. For those in Group 2 and Group 3, Group 2 being individuals from certain countries and Group 3 being our trainees, you can see that the early registration fee is here and the standard fee is here. So 4,800 for this 2-year program and 3,900 for the 2-year program. Again, the first payment is shown here, and then the subsequent payments are shown here. If one pays the entire program fee at once, then there is a further discount of $1,000. So if one were to register for the program by September the 1st and pay by September the 1st, all up front, then it would be $5,800 rather than $6,800. And that's important to us to reduce all the administrative time in this program. We have incredible administrative assistants who are not only so good at what they do, but they're, experts in navigating the website, navigating our software, answering questions about so many things. But it is really an owner's program from an administrative point of view. And we have administrative assistants, we have web developers, we have other contractors as well that work with us in the EBHF. When you add up all the people, there's about 7 of us that run the EBHF. So it's a busy program. But by paying the fees up front, it really just cuts down on all those administrative things. And so there's a further reduction. And so what we're really hoping is that a large number of people will apply by September the 1st as opposed to December the 1st and consider paying that up front. How do you apply? Well, you email us. And in the subject line, you write application to the EBHF. That's really important to us. It helps us keep track of emails. We have decided after much thought that we'll have the same email for our current system and our current fellows and our future fellows. And so please put that in the subject line. It really helps us keep track of emails. And we have hundreds of emails that come in every day. I'm sometimes afraid to ask the team how many more than 100, but there's hundreds. and pages and pages of emails. And so please write that on the subject line so that we can sort emails to make sure we're answering everybody. We need you to email us a one-page letter of interest. It could be 2 pages or 3 pages or 4 pages. Doesn't matter how many pages, but we want you to answer a couple of questions. And I'll show you what those are in a minute. It's on page 22 of the guide. I want you to send us your CV or your resume. I want to know your background. I want to understand your prior training, where you're coming from, how you've worked. That's really important to me. We have 125 fellows in our program right now, and I'm well aware of the background of everybody who has, been practicing 25 years, who's been practicing 1 year, who hasn't been practicing at all because they're a trainee. That's important to me because each week when I review your assignments, I review your quizzes, when we review your block exams, I reflect on that. I reflect on your development and how you're progressing in the program, and it's hugely important. So your resume is really important to me to understand where you're coming from. We just had week 61 of EBHF now, and I'll tell you, sometimes when I look at these MCQ quizzes and I see that this particular fellow got this question right, I feel that, wow, that's incredible achievement, because this is tough. That, with the material we've presented, with the readings and the way we teach the program, I hope that they'd get it right, but the knowledge and skills you need to get this question right is huge. And so when that particular fellow gets the question right, my feeling is, this is incredible. For that same question, another participant with a different background, I might feel, I would have expected they would have got it right. And so a lot of that comes down to your background. And so your resume is really, really important to me. So please send that in. If you're a trainee, we'll require a letter from your program director saying it's okay for you to participate. It's an intense program. And so you can imagine that if you're a hair transplant fellow and your time is supposed to be working with your hair transplant surgeon, we want your hair transplant surgeon to say to us, yes, it's okay if they participate. We want them to participate. We want them to be experts in hair loss. Great. Have your program director send us a letter. If you're a resident, have your program director say, yes, they've got the time to do this, and we'd like them to do this. We really encourage them to do this. That's important to us. We want to make sure it doesn't interfere with your training, and we want to make sure your program director is happy with us taking you under our wing and training with us, as opposed to your program director saying, this is taking away from our program. And of course, it's been a positive experience so far with all of our trainees. These are the questions we want to know. What do you want to achieve from this program? What fascinates you about hair loss? What do you find frustrating? What are you currently doing in the world of hair loss? Are you seeing patients now? Are you planning to see patients? And do you have the time? We want you to tell us you have the time. And we want you to tell us if you're a group 1, 2, 3, 4, or 5 practitioner. And we'd like you to tell us that you've reviewed the program guide or watched this video. So in your letter, tell us, I have watched the program video on YouTube. Or tell us, I've downloaded your 67-page program guide and I looked at it all. That's really important to us. We want you to tell us that you understand this program. That's all that we want you to know. We don't want you to sign up for the program and find that this is different than what I imagined. I thought it would be different. It's really important to us that everyone who signs up really feels that I know what I'm getting into and I can't wait. Can't wait to do this. So we begin accepting applications on March 1st. And so as of today, you may be watching this video at a different date than March 1st. The early bird deadline is September the 1st. So apply, and then if you can get your application and payment to us by September the 1st, you qualify for the early bird rates. And that's really important. by applying by September the 1st and considering payment up front, it can really save a lot of fees in this program. And then the final application is December the 1st. We're not sure each year how many late applicants will accept. It could be that we don't accept any, but certainly there will be a cutoff. You know, beyond 4 weeks in this program, it's almost impossible to catch up. And so that's another important point to be aware of. The intensity of this program builds, and it builds and it builds and it builds. And we have a lot of people say to us, you know, I see you guys are 6 months into the program. Can I join? I'm willing to catch up. It's impossible to catch up. And you'll only realize that when you come into the program, but it's impossible to catch up. We don't have an opportunity yet to do this program on your own, however you'd like, but that could be an opportunity in the next iteration. But this next iteration will be, I'd like you to follow week by week. January 5th is when your first video arrives in your inbox. Hello, welcome to the program. Here's your video, here's your quiz, here's your assignment. And January 7th will be our first Wednesday meeting. And you can choose whether you want to join in the morning group or the afternoon group. Those are times in Canada. You may look at those times carefully in your part of the world and decide what fits best. I'd like you to attend those. They're wonderful opportunities for us to get together as a group and for us to keep motivated together as a group. And it's an opportunity as well to, in the event you didn't do well on any of the block exams, to take it again. And again, I can't emphasize enough, there's no need to be worrying at all about performance in this course if you do the work in it. Watch the lectures, do the assignments, do the quizzes. It's a guarantee to excel in this program. The number of hours of, consultations with medical educators and adult learners to understand the principles that are important to have adults of all backgrounds excel has been enormous. And we know that the program is designed, if you do the work, you emerge at the finish line, and we wave goodbye to you, knowing that you have an enormous amount of knowledge and skill as hair loss experts. It really is that simple. So applications are now open. We look forward to receiving them. Email us your application, your CV, your resume, and your answer to those 8 questions. Put in the subject line, application for EBHF. And tell us all those answers to those 8 questions. If you'd like to attend a live webinar, we're going to have some question and answer so I can answer your questions. And there's one in June, our first one. There's some in July. And these are on the website. But when you email us, our team will email you these. There's some in August, September, October. And these are opportunities for you to ask your questions. And so if you have questions, you're not sure about this, I want to talk to Dr. Donovan, come to the webinar. That's how you get your questions answered. And the webinars are designed in a way where we respect your privacy. In other words, it's a webinar. When you come, there'll be a chat box where you can ask your questions, and I'll be there. You'll see me, but you don't have to show your face. The weekly sessions, when we meet every 2 weeks, we meet as a group, and if you want to show your face, you can. If you want to be on camera, you can. But the question and answer sessions are opportunities for you to come, ask your questions in the webinar chat box, get them answered, and feel comfortable doing so. And all throughout the program, your privacy is really important to me. A lot of programs, a lot of webinars, the leader is very adamant about be on camera, be on camera. Well, I'd love you to be on camera, of course, but you don't have to be. If you're the type of person, you want to be there every second Wednesday, you want to be part of this program, but I don't like being on camera, don't be on camera. If you want to come and join and be on camera, be on camera. If you want to ask questions during our time together, and then great. It's so important to me that we respect your wishes. We respect your wishes as a learner, your wishes as a participant, because we're going to be developing a set of skills that really respects the wishes of the patient. And it's that same type of thinking that really is part of this program. And so these question and answer webinars are for you at these dates. You don't have to show your face, but you can ask your questions in the chat box. Some great textbooks for the program. And if you participate in the EBHF, we'd love you to have these textbooks. If you don't participate in the EBHF, consider these textbooks. We'd love you to have a textbook. It's just another great way of thinking about material in a way that's different than Jeff. And this is a wonderful book by Dr. Shapiro, Dr. Losico, Dr. Ottberg, as well as other authors. And it's a really nice book. And it complements your learning in the EBHF. This is another very nice hair loss book by our colleagues in Europe. And another slightly out of date book, but still very relevant, by Dr. McMichael and Dr. Hordinsky, US dermatologists. And here's another very large book, which is really wonderfully designed. It's getting a little bit out of date, but it's still very relevant. If it wasn't relevant, I wouldn't have it as part of our course material. A really wonderful book, which maybe will be updated again soon. So I'd like you to have a book. I'd like you to have a trichoscopy atlas. And this really is our gold standard for the course. The atlas by Dr. Rudnicka and her colleagues in Poland, a beautiful atlas of trichoscopy. And again, if you want to dive deep in this program, you can do it without this atlas. Absolutely. The questions, the lectures, the trichoscopy you're going to be given in the EBHF is sufficient for you to develop your skills. But I'd like you to have an atlas that you can, in your office, turn to and say, let me remind myself about this. And this is a wonderful atlas. This is another really nice, very dense trichoscopy atlas by Dr. Doce and her colleagues. It's a really great book. It's thin. It is well priced, and it is written by world experts. And I love this atlas as well. It's really well put together. And another really important thing to consider. And you might buy one, you might buy two. They're great. Both the Rudnicka and the Doce Atlas are fantastic. This is a little bit older, but it's easier to read. You can do this in 4 hours. It's Dr. Tosti's Atlas, and it's a really nice resource as well. It's smaller and a little bit less expensive than the Rudnicka Atlas, and again, easier to get through in a short amount of time. And there's one pathology text I'd love you to have, especially important for those, clinically oriented hair specialists that are looking to really push the stratosphere of becoming a hair expert. This is a beautiful book created by Dr. Mateva. And it's extremely well written and put together. And it will complement your acquisition of skills. And I would really encourage you to purchase this. I think that 3 textbooks, which would be wonderful for you to have in the EBHF, would be the 3rd edition of the Shapiro book, the Rudnicka Atlas, or the Doce Atlas of trichoscopy, and this Mateva book. These are wonderful. And congratulations to our colleagues for bringing these to our field. Look at the smiley face of this wonderful hair follicle. It's a fun program. It's an enjoyable atmosphere. And I look forward to seeing our fellows each and every week. And more importantly, I really enjoy watching them develop these skills. And the intensity of this program is something that really needs to be repeated. These are individuals that are really working hard to develop skills like no other. And we'll be saying goodbye to our fellows in August, ready for the new group in January. It's not an atmosphere of competition. You'll never know another person's score on a quiz. You'll never know another person's score on an exam. Of course, if people want to share that, they can. If they want to be doing that, I encourage that, of course. But it's not an atmosphere of competition. It's an atmosphere of helping each other develop as hair specialists. We're going to make mistakes, and it's important to come to this program with a feeling that we're going to make mistakes. And some of the program is designed to help you make that mistake so you can correct it and not make it again. And it's really to develop a framework of skills which will set you up for lifelong learning. We're going to be treating, like in plain old pilaris, androgenetic alopecia and alopecia areata differently in 25 years. I promise you. But the skills and the problem solving and the approach will be identical. And so we're really developing that framework which cannot be shattered. And that's really what expertise is all about. So visit our website, donovanhairacademy.com. Watch this video again, should you wish. Read the program guide. I see in the last slide that it's 67 pages. Review it. And then email us. Email us your resume and email us the answers to those 8 questions. Attend an information session in June, July, August, September if you find it helpful. Ask your questions at those information sessions. Meet that September 1 deadline with your application and payment if you find that that's what you'd like to meet. Otherwise, be sure to get it in by December. And wait for an email from our office telling you've been accepted. I'll review all the applications. And I will let you know if you're accepted. And if you're not accepted, don't consider it as anything bad, but simply a time for you to continue to develop your skills, take some courses, other programs and training in hair loss, and come back and see us again. You're just going to find the program so much more enjoyable the next time. And instead of finding it frustrating, you're going to find it and just an incredible joy. And that's what we want you to feel. We want you to really fall in love with this field of hair loss in a way that allows you to really help others in the future. And I think that is it. Email us info@donovanhairacademy.com, and we'll post this on our YouTube channel very shortly. And I think that is it. I'm going to leave you with some comments from our participants. These are current 2024-2025 fellows who have been asked, can you send in some comments so that we can tell others what the program is about? And these were sent in anonymously, so we don't know who these are. And we've given all the comments here. And this is what they said. And participants had an opportunity to say the good and say the bad, and this is what they wrote. So I'll leave this with you. You can read them slowly yourself. And I hope these comments are helpful to reflect on this program. And I look forward to seeing you at one of the webinars. If not, I look forward to seeing you in January for the 2026-2027 EBHF program. Thanks so much for your interest, everyone. I'll see you again.